Breaking tonight, just about an hour ago, Fox News confirmed that the administration knew as early as 2010 that millions of Americans would lose their health care plans, even as the president explicitly promised the opposite. While the president said these plans would be grandfathered, so if you had a plan that you liked when Obamacare was passed, you could keep your plan, we have found an IRS bulletin from July of 2010, Obamacare passed March of 2010, saying, quote, a reasonable range for the percentage of individual policies that would terminate and therefore relinquish their grandfather status is 40% to 67% of those in the individual market. Joining me now, Kristen Soltis Anderson, Vice President of the Winston Group and Republican pollster, and Mark Hanna, who's a Democratic analyst. The president specifically said, let me just tell you what happened. They met, they had the health care summit. John Kyle, a Republican senator, said to him at that summit, he said, Mr. President, I'm concerned about the individual market because you're going to require that these policies offer all these goodies in them. And that's going to jack up rates, or the insurers are just going to say, I'm not doing it, I'm canceling these policies. And the president said, no, because I'm going to grandfather all those policies, and people are going to be protected. Here was the president, February 2010.
Actually, any insurance that you currently have would be grandfathered in so you could keep. And so you could decide not to get in the exchange the better plan. I could keep my Acme insurance, just a high deductible catastrophic plan. I would not be required to get the better one. 4
months later, an administrative memo talking about how over 70% of the individual insurance market was going to get canceled. And the president in 2012, Mark, came out and reiterated what he said, that if you like your plan, you're going to get to keep it. So I ask you what I asked Dr. Ezekiel Emanuel on Friday. Was he intentionally misleading, or was there some argument that he was grossly mistaken?
He was doing neither. What he said was absolutely correct. If you had a plan before 2010 that hasn't changed, that your premium hasn't increased, that the terms of those plans haven't changed, you can absolutely keep it. Let's also put these numbers in perspective, Megyn, because you're throwing around 60%, 75% of the individual
let's stand point. Hold on. Let's stand point. Hold on. It's not true. Over almost 1 million people have been canceled so far, Mark, and the estimates are that over 10, perhaps as many as 14 million could be canceled soon.
What's key about what Mark
let Mark respond to that, and then I'm going to give you the floor, Kristen. Go ahead, Mark.
Right, because these plans that don't offer the basic protections that the president has been saying all along are required in any insurance plan, unless it is grandfathered beforehand, these plans are illegal, and the president has been saying that forever. But the individual marketplace for insurance is only 5% of the people in this country. We're talking about 2 or 3%.
No, we're talking about up to 14 million people. Up to 14 million people. Kristen, I give you the floor.
Right. Megyn, let's talk about 3 times as many of those, 6 times as many of those people don't have any insurance whatsoever right now.
He said,
those people
period. He said if you like your plan, you can keep it,
and they can't keep it. There are people
who like their
plan. I promised Kristen the floor, and I give it to her. Go ahead, Kristen.
So there's something critical in what Mark said that sort of opened the door to this whole, if you like your plan, you can keep it, being shown to not be true. And that's if any piece of your plan changed at all, then the grandfathering gets thrown out the window. And so all of these folks, whether it was something about your deductible or your copay, so it's this little tiny loophole that came from this law that's allowing the law to get rid of all of these policies. I mean, this whole, if you like your plan, you can keep it. This takes kind of a shot at a Republican president, but is sort of the read my lips, no new taxes of this president. This isn't just a line that he said in a speech one time and that, may have been an exaggeration. This was a core piece of the administration's argument for why people should support this law. Don't be afraid. If you like your plan, you can keep it. And the very same people who tend to use this, who tend to use this individual insurance, they're entrepreneurs. They're people who need to insure themselves, and now they don't have these plans available to them.
But here's the thing, Mark. If he wanted to make clear, if he wanted to be honest, he should not have said, period. He should have said, asterisk. I want the 14 million Americans who are out there who I believe are going to lose their individual insurance plans to understand that that's a risk. And then they can call their representative and tell them to vote for Obamacare or not based on the full disclosure of the information.
Right, and let's wonder why these plans are illegal in the first place.
No,
it's not
no.
because of
Come on,
any
respond to
individual choice.
I know you can bridge a way to a happy place for you. Okay, I get that, and that's a skill.
This is
debate
all a happy
skill.
place. Obamacare is the law of the land. I'm a happy man right now.
Speak
We're
to
going
my
to have
point. You're better
40
than this.
million people that were uninsured, not uninsured anymore.
Speak to my point.
Okay.
That's fine. Okay, that's fine. So speak to my point.
Yeah.
Let's have a substantive discussion. Why did he say period? Why didn't he say asterisk?
For emphasis, probably. Look, the guest that was on before said exactly that. That any time there's an incremental change in your plan, and you know insurance companies change their plans all the time, and they send you a letter, and it's all in the fine print. Nobody really reads it. And that was part of the law. HHS, Health and Human Services, under Kathleen Sebelius, made that public. Reporters, including yourself, had access to that information all along. Maybe it was underreported. I don't know. But the fact of the matter is, those programs that have skimpy benefits and high out-of-pocket costs, where taxpayers like me have to pay when somebody gets hit by a
Kristen,
car,
it was my fault. It was the media's fault, and it was the American people's fault, because they should have understood that period did not mean period at all.
What they're trying to do is they're trying to go into this whole other point that, well, it should never have been considered insurance in the first place, and that really exposes what a lot of this is all about. If you go back to the Supreme Court argument over whether Obamacare was constitutional or not, the debate centered in many ways on whether or not health insurance was something everybody would need, and therefore it was constitutional to mandate it. And the question was, is health insurance the same as health care? Conservatives say it's not. Health insurance is something that should protect you against risk. It should not be the mechanism of payment for every health care service in your life.
The thing is, you were grandfathered, as the panel pointed out, unless they changed any part of your policy. And then guess what happened? The Department of Health and Human Services then wrote regulations that so narrowed what the insurance companies could do that virtually all of the policies had to be changed. And that's why we now have millions who are getting canceled. Kathleen Sebelius did it, and the president knew it,
and the insurance companies are
out.
Canceling it.
And the president knew it, Mark. Either he knew or he negligently didn't know. If he didn't foresee this, then that's the question. I got to go because we have Rand Paul coming up, but good debate, you guys.
Okay,
Thank you.
good to see you, Megyn.
Okay. Taking your